When I was 12 years old, I fell out of a tree and broke my back at the T12 level. So since I was the age of 12, I've been in a wheelchair functioning as a paraplegic. And in the state of Minnesota, where I was born and raised and grew up, there was a number of opportunities. One was wheelchair basketball, which I became involved in a community context. And that kind of followed through after high school, went on to medical school, after college, and up at the University of Minnesota, where I attended medical school and residency as well. I participated in wheelchair basketball, wheelchair tennis, wheelchair softball, all kinds of adaptive wheelchair sports during that time. As a spinal cord injured person myself, the experience I had with how healthcare helped me to adapt and to overcome my injuries, it was a natural gravitation toward healthcare. And then in medical school, I wasn't certain what I wanted to pursue. I just kept my options open. I enjoy all fields of study and was willing to consider all things. I was looking at primary care, family practice, radiology, different specialties, and rehabilitation medicine was also something that was of interest. So as I went further in my training, I became more and more interested in the rehab side of things because of probably the call of my prior experience with spinal cord injury. So after graduating from medical school and then residency in the Twin Cities, I found Madonna to be the most overwhelming in terms of opportunity and things that I wanted to pursue, flexibility, doing inpatient, outpatient services. And it was an easy choice for me to come to Madonna. And then once I did set up here, there was a need for a person that would take on the spinal cord injury unit and become the medical director. You get to follow patients from early on after their trauma. We get them, usually a week or 2 weeks after their injuries, when they're still quite impaired, having a lot of pain issues. So that's the fun part of the specialty of rehabilitation medicine, is you get to follow them over a long period of time, and then even after their discharge, follow up with them and help them with becoming integrated into the community, managing all those issues, and see the fun outcome. That's what makes rehab so enjoyable. Very supportive, very encouraging to see a person that also had a spinal cord injury roll into their room and tell them, hey, look what I've been able to accomplish. There is a life after this. And almost to a person, I hear that kind of feedback from people, that it is a definite positive, seeing someone that was able to go on and do whatever they wanted to do in life. And then I relate to my personal information. I was able to go on and have a family, became married, had 2 children of my own, and lead a very active, fulfilling lifestyle. Just the joy and satisfaction I derive from helping a patient from early on to final outcome, and it's just such a rewarding, wonderful field I'm in.